Good evening, everyone, and let's do the practice of systemic therapy. This is one of the domains that I've been getting a lot of feedback on, which how they can make themselves much stronger in this domain. I will work through in this video what this domain entails, how you should be looking at these questions, and what it is you need to know in order to answer these questions more effectively to help you navigate in finding the best answer out of the 4 responses that you will receive. So the first thing is first, what does this domain cover? To me, it covers about everything. That is how I looked at it. Anything that you can think of, it covers it, because it's looking at you being able to identify those terms, know what those terms mean, and then how are you going to apply it to one of the questions that you are going to have. This domain includes the models. Definitely going to include the models, and there are things that you need to know from each of the models in order for you to answer these questions the right way. The client systems, the couples, the families, and individuals, also in the relational content. Yes, we will get individual clients that we work with, and you will see those kind of questions in this domain, as well as many others. But for the scheme of all things, we are family therapists, so we will be working mainly with the couples, families, or the more relational context, right? So also in this domain, we're looking at the therapeutic alliance, that's building that rapport with your clients, as well as treatment planning, right? So like I said, there's everything is mentioned in this domain. To me, this is how I see it, everything. It has the most questions, 42 questions in this domain. 23% of the exam makes up for the practice of systemic therapy. This is one of those domains where you are going to have to knock it out of the ballpark. This one domain is there's no leadway in it. You have to knock this one out of the ballpark. Get as many right in this domain as you possibly can, because the rest of them, they don't have as much as this one, but this is a domain that has 42 questions, and it is imperative. You gotta get as many right as you possibly can in this domain so that it can carry you for the rest of the other domain that you might be just a little bit not, okay in. So yes, this domain to me, like I said, it's everything. I look at it as being so many different things that you have to know. And again, this is what I found out. Your theories, know your major theories when it comes to this domain. And when I say know your theories, you got to know the goals, the therapeutic role that those therapists use, interventions that they are using, as well as the problem, how they view the problem, and how they help you look at that problem differently, or how they help you find that symptom relief, whatever the case may be. You must know your theories. I cannot stress that enough for this domain. Know the goals. Be as versed in these models and how they use these interventions as much as you possibly can. And remember, apply systems thinking. We are family therapists. Avoid answer responses that talk about breaking up the family system unless it's justified to do so. I will say that there might be questions where it's where it's justified to do so. And when I say that, I mean it depends on the theoretical approach that may be using, or we can have some intimate partner violence that's going on. Make sure that it's justified to do so, because there are exceptions to this. Also, pay attention to patterns or roles in the family, or people trying to label somebody else as being the problem. That's that identified patient, right? Labeling who's the problem. It's not just one person is who's the problem, right? We are a family therapist. We look at the family as a whole, right? There is just not one person that causes the whole problem for and why the system is being dysfunctional or being disruptive. This is a tactic that you use for any domain. Eliminate. Answers that are individually focused in a systemic question, you need to avoid it unless you have justifiable evidence to do so. Overly directive, or it's questionable, with the ethics piece. Can I do that? Am I allowed to be doing that right now? Can I be giving somebody advice right now on, why they have so many headaches? Ask yourself those things. Can I do that? Am I allowed to do that? Right? Here it is, right here. This is the main thing. Matching those theories. Make sure that if that question is asking you about narrative therapy, the response has to have something to do with narrative therapy. Narrative therapists don't assign homework. So that will be a response that does not match that, right? So also, if you were to look at narrative therapies does not prescribe the symptom. The therapeutic mismatches, you have to pay attention to that. Pay attention to it. Even though it may like, oh, well, that sounds good. That sounds like it's something I can do. But the theory that is presented, does it match that intervention that question is asking you about? Pay attention. Eliminate if it does not match that theory that question is asking you about. Slow down. Pace yourself. Watch for those red flags, like I call it, or the qualifiers that are in that question. Best, most likely, first. What do you do next? What's the best clinical response? What's the most appropriate response? Especially if they're asking you about something specific that you need to do, like an intervention that they're asking you to do. Slow down and make sure that you are looking at that question the correct way so that you can respond to that question with what they are asking you for. And again, the therapeutic action that is going to reflect that theory. That therapist's action must match the theory that they are talking about in the vignette. And always, 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 I am big on this. Safety always comes first. I don't care what kind of question it is. Safety is always going to come first. Please don't ignore those red flags that is telling you that this kid is being abused at home. And then you're going to talk about meeting up with them next week for a follow-up session. You're going to get it wrong. Safety comes first. Check and see if there's anything that you need to know that's ethical. And then maybe assessments. And then maybe you need to do an intervention as none of the other stuff is listed. There is a process to these questions. Slow down and pace yourself. Watch for those qualifiers and look and see what that question is asking you. These are a few exam tips. This is what I want us to do, and you don't have to watch the screen. I know it's a lot. This is how you can narrow down and choose the correct response when it comes to the practice of systemic therapy. Again, match your interventions to the model. If the question is asking for a specific model, make sure that it is going to align with the theory that is in the responses. Avoid the individual focus options unless you have enough information that is justifiable for you to do so. If you're working with a if you're systemically working with a family and the vignette mentions that that there's about 5 or 6 people in that therapy room, then 9 times out of 10, you're going to have to include all of those people in a response unless it's Bowen's approach. Bowen will do that. Bowen will work with one person or whatever, one people to you. He works with the individuals, the dyads and the triads, but pay attention to the question. Make sure it's asking you. Make sure it's not just one person in that therapy room. If it's 5 or 6 people, make sure the whole family is included. What I have noticed about these questions, the practice of systemic therapy, and if you don't believe me, try it out. These questions are presently focused at all times. Presently focused. They're always looking for the present focused response that you're given. What's going on in that therapy session right then and there? It's not past oriented. They don't want to be talking about nothing that's going to happen in the past. They want to know the here and now. What are you doing right here, right now to work with this issue that you have, right? Again, the clinical fit. Who is doing what? If it's a strategic therapist, you know what they do. They give directives. They're telling you what to do. You're not the expert. The strategic therapist got the answers to your life and they're going to fix you. If it's Bowen, what do? They're neutral. They're non-directed, but they coach you. They are coaches when it comes to working with you. Structural is what? They do what? They restructure the theme of the family. They restructure the family system. And solution-focused therapists, narrative therapists, collaborative, what are they? They are not the expert. The client is the expert. And these therapists do what? They ask a ton of questions. They pick your brain, right? Slow down. Pay attention to what the question is asking you. Know your interventions, know your models, know which terms match which model. That's why I say you have to know which terms go along with which model so that you know that you can identify the language in that vignette whenever you see a question. So let's do some questions for the practice of systemic therapy. And of course, none other than our good old Chat GPT. I've looked at these questions extensively. I'm like, okay, make it make sense, Carrie. Does it sound right? Yes, it sounds right. The questions are fine. They are okay. Some of the times you can catch questions from Chat GPT and people are telling me that they're on the exam. So use it if you want to. A couple comes to therapy reporting frequent arguments about finances. The therapist uses a Volinian approach. What is the therapist's primary focus in the early phase of treatment? So let's stop there and we're going to just look at that question. Don't look at the responses just yet. We're going to look at this question together, just looking at the question. Now, it's Bowen. It's highlighted. Highlight that. If this question was on the exam, what would you highlight? Let's start there. So if this question was on the exam and I am taking this test right now, one of the main things that I would circle is I'm going to circle a couple. I'm going to highlight a couple. I'm going to highlight that there's a Bowenian approach. And then I'm going to highlight the primary focus in the early phase of treatment. So if I'm seeing the early phase of treatment, I'm automatically thinking about what does a Bowen therapist do in their early phases of treatment? They do a genogram. They look at the family of origin. That's what I'm doing. Those are questions that I'm asking myself, right? So let's look at the responses. Encourage the couple to express their financial frustrations directly to each other. Why are we doing that? So you can start an argument in the therapy room? No, absolutely not, right? And I don't even, EFT, maybe they would do that, but I don't see that happening, right? Identify coalitions and restructure the family hierarchy. This is where it comes in at. This is where you know your terms to match each of your models. It asks for a Bowenian approach. B is a what type of approach? Structural therapy, right? D says assign a paradoxical directive. Stop right then and there, because as soon as we see paradoxical, we automatically know that's strategic. Strategic and Bowen is two different theories, so we're going to do away with it. That brings us back to C. Explore the partner's family of origin patterns and increase differentiation. Before I even looked at the answer responses, I asked myself, what does a Bowenian therapist do in the early phase of treatment? That led me to my best answer. That and also the process of elimination. Let's move on to the next one. A family comes to therapy with a 15-year-old girl who has been isolated in her room and skipping school. The mother is anxious and overly involved in the girl's daily life, while the father is disengaged. What theoretical concept best explains this dynamic? Before we look at the answer responses, let's go back and look at the question, and let's take a look at some of those terms or phrases or whatever that we can highlight that is going to lead us to our best answer, right? So if I was taking this exam and this question was on my test, I would highlight 15-year-old girl. She's isolating herself in school. She's isolating herself in her room, and she's skipping school. And then I also would pay close attention to the fact that the mother is anxious and she's overly involved in that girl's life. She's doing too much, right? But then the father is disengaged. So then I would take a look at my responses and I would work my way through it. And this is what I mean when I say work your way through it and make it make sense. A says an emotional cutoff. Well, did anybody have some issues with somebody and then did they leave and then just stop talking to them? Nope. So we get rid of it. C says triangulation. Well, is there two people here and there's some conflict that's going on and now they're drawn in the third person? Nope. So get rid of it. D says parentification. The 15-year-old girl doesn't seem like she's taking over the household where she's got a job and she's taking care of mommy and daddy. The parents seem to be doing that, so we're going to get rid of D. And that leaves us with what? Enmeshment. Because if we pay attention to, the mother is overly anxious and she's overly involved in her daughter's life. That led us to B, enmeshment. And I say that to say this. Know your terms. If you know your terms, you can automatically eliminate the ones that just doesn't make any sense. Make it make sense. Okay. A 16-year-old client tells a therapist that she is sexually active and does not want her parents to know. The parents are unaware and want to be informed about all the aspects of her daughter's life, so they are just breaking boundaries. They just want to know everything about this girl. What is a therapist's best response? And I like these kind of questions because then, now, don't look at the responses just yet. Just look at the question. If you were taking this exam and this question was on your exam, what would you highlight? What would you let yourself know that, hey, I need to pay attention to this, right? So I would go back, and this is what I would do. She's 16 years old. I would highlight that. She's sexually active. She does not want her parents to know, right? But her parents also want to know all the aspects. And then I will also highlight best response, so I can keep that in mind that this is a best response question, and I need to respond to what is going on in this vignette, right? A says, inform the parents as they are legal guardians. That's not me responding to the girl saying she's sexually active and she doesn't want her parents to know. That's what I mean when I say responding to what's going on in the vignette for these best response questions. C says, encourage the client to tell her parents while remaining neutral. Now, here is the thing. This is not you responding because the girl done already told you she don't want her parents to know. So why are we encouraging her to tell her parents? And how are you going to remain neutral when she's already disclosed this to you? I'm thinking maybe you have rapport with each other, but now you're telling her to go and do something that she doesn't want to do in the first place. You can't remain neutral, right? D says break confidentiality to ensure family transparency. Now, A and D are both unethical because it breaches confidentiality when you think about it. Nothing is going on in this vignette that poses any harm or any risk. So why do we need to break confidentiality? Let's look at B. Maintain confidentiality and explore the teen's readiness to disclose. Maintain her confidentiality and then work on her with options. If she wants to tell her parents, she can. It's not saying like she's, and I hate to say it, but she ain't out here being a prostitute standing on the corner. I mean, now that's something that you really probably should be reporting, but she's 16 years old, she's sexually active, and she doesn't want her parents to know. So explore options with her, but you can still maintain confidentiality while you're doing so. Okay? Let's look at the next one. Chat GPT has gotten it right tonight. I will tell you that. It took me a while. I extensively looked through these questions and I dissect them just to make sure, okay, this goes on a line with this and just to make sure, right? A therapist is using strategic family therapy meets with a family whose teenage son has been staying out past curfew. Okay, now we got some little rebellion going on. What is the most appropriate intervention? So before you look at the answer responses, take a look at that question again. Walk your way through it. What are you going to highlight? What sticks out to you, right? Strategic therapist. That is one of the things that we would highlight, right? Strategic therapist. We have a teenage son staying out past curfew, right? Appropriate intervention. Now, this intervention from a strategic family therapy it's got to be somewhere in these answer responses, and it must match that theory that is being mentioned in the vignette. A says, ask the son how he imagines things would be if he were home on time. Well, that doesn't sound like strategic, does it? What does that sound like? Sounds a little bit more like solution focused, right? So, of course, we're going to do away with that, right? B says, instruct the parents to reward the son each time he is home before curfew. That doesn't sound anything like strategic, but you know what it does sound like? A behavioral approach. We're a reward system, so we're going to do away with that. Encourage the family to explore how past experiences contribute to the current issue. So now we're digging into the family of origin, and we know that strategic therapies doesn't really do that, so we're going to get rid of it. That's more like a Bowen approach, psychodynamic approach, right? Where we're going to be digging into past experiences. Now, if we take a look at C, direct the parents to tell the son he must stay out later than curfew. All right, so now here, let's look at this, the kicker. Because we know that strategic therapists are what? They are directive in nature. They tell you what to do. And that first term says direct. When it comes to strategic therapy, look for terms that say direct, instruct, tell them, ain't no asking, because the strategic therapist he knows how to solve your problems. Ain't no asking, ain't no encouraging, just do what I tell you to do. Think of that when it comes to strategic therapy, right? Now, I kind of like this one too. Okay, a 10-year-old child is referred to therapy due to aggressive behavior at school. During the first session, the therapist noticed the parents interrupt and correct the child frequently and the child avoids eye contact. Which systemic principles should guide the therapist's initial understanding? Now let's stop, take a look at this question, and see if you were taking this exam and this question was on here, how would you navigate your way through this question? What would you highlight? What sticks out to you? Right? So let's go. If this is me, and this is me walking us through this, right? I would highlight, and I always highlight ages. I don't know why, I just do. So 10-year-old girl, she's referred to therapy, right? The therapist is noticing, and here we go. I would highlight the parent interrupts and correct the child frequently. And then I would highlight child avoids eye contact. And then the next thing, initial understanding. So this is the initial understanding. We're not jumping the gun. We're not jumping through loops, jumping over anything. It's just your initial understanding. And sometimes we look past those words, but those words are so important, right? The systemic principle that is guiding the initial understanding. Let's take a look at A. The identified patient is a reflection of the family system's dysfunction. Okay, I'll take that. Sounds systemic enough, right? Now let's look at B. The child is using aggression as a coping mechanism for trauma. Well, nothing about trauma was mentioned in this vignette, so we get rid of it. That's the critical thinking component that I'm talking about as well. If it ain't mentioned in there, don't try to make it stick in there, right? C says the parents need individual therapy to address parenting skills. There it is, that question about breaking up the family system. Why are we going to get the parents individual therapy? What about that 10-year-old girl who aggressive has increased? What about her, right? D says the therapist should focus on building a one-on-one alliance with the child. Now, if we take a look at D, who is this vignette about? Is it about the therapist, or is it about this family that's coming in with this 10-year-old girl who aggressiveness has increased at school? This is not about the therapist, so D would be wrong. Let's go back to A. The identified patient is a reflection of the family system's dysfunction, and you can tell who the identified patient is. The identified patient is the 10-year-old, because if you take a look at it, the parents are controlling. They interrupt her when she's talking. They correct her. Does she have anything that she wants to say, anything that she believes is true? And now her reaction to how her parents is treating her is that she avoids eye contact. There is no identified patient. Everybody is a part of the system. But the initial understanding is the parents seem to think that the child is the issue. They don't even let her talk. They cut her off. You're the reason why we're here in the first place, right? I hope that makes sense. Okay, alrighty. A family in a crisis after a sudden death. The therapist feels overwhelmed by the family's distress and notices a strong emotional response. What is the therapist's most appropriate next step? So stop. Let's look at this question before you look at the answer responses. If you were taking this exam, what would you do right now, right? So I would highlight crisis after a sudden death, but do not ignore putting family in there, right? Even if you know that this question is going to lead to something different, make sure you're going to be highlighting that word family at all times. Don't ignore that, right? The therapist feels overwhelmed. Highlight overwhelmed. The therapist feels overwhelmed. And then a strong emotional response to this family. So what is the most appropriate next step? So questions that say next step are the questions that mean, what are you going to do literally after this? Not way down the line, after this, right? A says, disclose the emotional reactions to the family to build empathy. Why am I doing that? And what exactly are you going to tell this family? That you tired of them and you tired of listening to them and you feeling overwhelmed? No. B says, refer the family to another clinician immediately. And these are the funniest questions when it says immediately. So now we're just being unethical and just abandoning them, right? They don't know what's going on. They're there for you to help them. They're in a crisis after somebody died. And now you're just going to abandon them and give them to another clinician? No. D says, continue therapy without disclosing or seeking support. Here it is again. And they will put, I've seen questions like this on my exam. without disclosing or seeking support. Don't go for the questions that's telling you to avoid. Again, the red flag in this vignette is the therapist is overwhelmed and has a strong emotional response. D is telling you to ignore that red flag in the vignette. But if you look at C, seek consultation or supervision to manage your countertransference, because that's what's happening. The therapist feels overwhelmed and a strong emotional response. Whenever you see a vignette that says that the therapist has a strong emotional response or strong belief about something that's going on with that individual or that family, most likely look for a response that's going to say something about consultation or supervision for your countertransference. Okay? Alrighty, so how are we feeling about the practice of systemic therapy? Again, there is more questions in this domain than any other domain. Strive to get a high number in this domain so that way it can carry you throughout at least maybe 2 others that you're going to be lacking in, right? Know your theories, your interventions, your goals, the terms. You have to know the language so that you can match that therapeutic model to the responses that they are giving you, okay? If you have any questions, comments or concerns, drop me a message, leave me a comment, contact me on Facebook. I am around. I am here to support each and every one of you. Alrighty, good job everybody. Bye.